last question before I shift the conversation a little bit. Like, what is your favorite thing about the Northern Mariana Islands?
Um, it ties back to what I said earlier. I will say, though we live a very simple life, it feels very full. During my undergrad, I lived by myself. I had a lot of friends and family who were there to support me, but um, every time I came home, I felt full in a different sense, and I would
Mhm.
always be, people are like, "Oh, how can you be homesick? Like you're with a lot of your friends that were from back home." I'm like, it's the simple things that I guess made me realize like how much I loved and wanted to live at home. It was like I just missed noise. Like silence is so deafening to me, and it like I know everybody needs a moment to themselves here and there, but I really do like just walking by people who I know each other, just like walking by people who sometimes like I feel like you can feel it off of somebody when you feel like they're in a state of fear or like they're uncomfortable, and just being able to walk out of my office and just know, even though there are people who are not feeling at their 100% best, like they find comfort and feel safe in a space, and that means a lot to me. Um, because we really do live in a world that is so different from even 5 years ago, let alone 10
Mhm.
or 20. So that feeling, it's not something that I you can really write down on or pinpoint what it is, but it's there, and that's what I enjoy most about being.
Well, thank you for sharing. I hope
Yeah.
that I'm able to visit there sometime near in the future.
Yeah.
I'll definitely keep you updated. But that's amazing, and I'm looking forward to hearing. And I guess like to tie this more into public health, how does that sense of community and that sense of belonging tie into your understanding or the way that you practice public health?
I definitely do think that everything we do has like a community part. I've never been part of a project or part of a program or participated in anything where it wasn't community clinical linkages. It wasn't partnerships. So that's why, truthfully, I'm always amazed over, like, I've been in my career for almost like just about 10 years, and constantly it's grant after grant after application. And I think it's, like it spans more than 10, 20 years where there's always a section that calls for like community partnerships. And it's so weird to me that that has to be spelled out, because and maybe it's because of the limited resources that we have, but what we'll always have is another human, another person in another space. Like, I may not have all the like physical supplies of like medical supplies or this guidance book or that, but what we do have is like people with lived experience. And I think that that's something that is so important in our culture and our health system, and especially in public health. I think there's a lot of mainstream stream things that have changed over the years, but truthfully, what is consistent is the need for community partnerships. So, I don't think taking the approach of community clinical linkages is a new or innovative idea. I think it's just really expanded and to be called that term, right? Maybe 30 years ago, like if you went into the clinic and you needed something that was like not being able to be provided in your doctor's office at that time, there would like be like maybe two or three partners, like, oh, we can call social services or we can call like the bigger hospital or whatever. But now what public health, or actually the whole health spectrum, I think has expanded to is something that like I do admire it. Not just for the nation, but for the world. It's like, how you now have specialty services like behavioral health services. It's like even services that are targeted to the elderly or just the kids or just the people who are like trying to figure it out, like um really what health has expanded to, and all of those different avenues, I think is why we continue to hold on in the importance of community clinical linkages, because a lot of times I feel like when you think of like clinical aspects and clinical treatment, it's so standard. It's like A, B, C, D. And if anything, it's just getting upgraded by new medicine and whatever. But, there's always a part that like after you receive that care, like there's the foundation and lifestyle change that's not happening in your doctor's office every day. Your lifestyle change happens at home, whether your home is your own personal home, whether it's somebody's couch or it's somebody's like corner with just a roof over your head. It's like all those aspects where I feel community spaces are more welcomed. And truthfully, um, don't have a price, right? And I think community clinical linkages tries its best, or, it's almost like, I don't want to say safety net. It's just like trying to provide like a solid foundation that actually spans. So you don't feel like you're only solid on your feet for like an X amount of time. Like the goal is for it to continue to go and build and have a whole pathway till, truthfully, you're like at your end of life. Like, so that, that's really why I think it's important, especially in our community, in our health system. Uh, we run a health organization we have the sole hospital. We're semi-autonomous. We have the public health agency and we have the behavioral health agency. And we're all intertwined into one health organization. So within that, it's not it's not an outside thought. It is literally what happens, whether you're getting discharged from inpatient in the hospital or you're done with your annual doctor's visit in the clinic. Like these are all things that are rotating and being advocated for, and we don't, nobody has been able to do it perfectly yet. But I will say we are trying our best, and we that is something that we continue to strive for and strengthen, so that it's not just modeled within our system, but within all our